Hello, welcome everyone to the McMaster Health Forum here at McMaster University in Hamilton, Ontario for our latest Queen Elizabeth Scholarship presentations. Here is an agenda for what we will be covering today. I will give you a quick little summary of the McMaster Health Forum, the actual scholarship program, and then what that scholarship program looks like here at the forum. I will then introduce you to our scholar presenters, and then we'll have a question period at the end. If you are watching this later on YouTube, the two scholar presenters will be split into two different YouTube videos, and the questions will not be recorded. So the McMaster Health Forum is the leading hub for improving health outcomes through collective problem solving. We harness information, convene stakeholders, and prepare action-oriented leaders in an effort to act as an agent of change by empowering stakeholders. The Queen Elizabeth Scholarship Program, which is formally called the Canadian Queen Elizabeth II Diamond Jubilee Scholarship, and you can understand why we usually shorten that to QES, is managed through a unique partnership of Universities Canada, the Rita Hall Foundation, Community Foundations of Canada, and Canadian universities. This program is made possible with financial support from the Government of Canada, provincial governments, and the private sector. The purpose of the QES program is to activate a dynamic community of young global leaders to create lasting impacts both at home and abroad through cross-cultural exchanges encompassing international education, discovery and inquiry, and professional experiences. Here at the McMaster Health Forum, we've had two different Queen Elizabeth Scholarship programs. Our current one, which is our second program, we were very proud to be selected as one of 20 Canadian institutions to host that second round of scholars. And that began in 2018 and was scheduled to run until the end of 2021. But due to certain circumstances, there was an extension for the program to the end of 2023. The focus of our current Queen Elizabeth Scholarship Program is strengthening health and social systems, and our scholars who are participating in that program contribute to strengthening health and social systems to become part of our growing network of health and social systems leaders. On the screen now are some of our scholars from our original program, which began back in 2015. We had 14 incoming scholars by the end of that program and 3 outgoing scholars by the end of that program. And a large number, as you can see, 44 in total of outgoing interns as part of that program. Our current Queen Elizabeth Scholarship Program, which is ending in December of 2023, we've had 7 incoming scholars and 24 outgoing interns, and our 2 presenters today are part of the outgoing intern group. Our scholar presenter today is Amandeep. During the Queen Elizabeth Scholarship Program, Amandeep was a graduate student in the Global Health Program at McMaster University. Amandeep's interests lie in addressing the impacts of social determinants of health through multi-sectoral collaboration to promote health and social equity. And during the QES internship, Amandeep hoped to further her skills in bridging the gap between researchers, policymakers, and civil society to develop locally informed and culturally sensitive health policies and programs. So Amandeep, I will mute myself and turn it over to you.
Thanks, James. Hi, everyone. My name is Amandeep, and it's a pleasure to be here to share my QES experience with you. This summer, I was fortunate enough to intern at the George Institute for Global Health in India, also known as TGI, as part of my QES experience. So to jump right in, on the next slide, here's a bit of what I'll cover today, starting with an overview of TGI and its mission, the projects I got to work on while I was there, some of my travel experiences around India, and a bit about what the outcomes and key learnings of this experience have been for me. Next slide. So the George Institute for Global Health, or TGI, is a leading international health research institute. They have offices in Australia, China, India, and the United Kingdom, but they also do have research projects that are based in countries outside of these regions as well. They also have a number of key academic affiliations and partnerships in these countries, such as with the University of New South Wales, Sydney, and Imperial College London. And the goal of TGI is to address global health challenges that are having a significant impact on human life today, particularly in marginalized and underserved regions of the world. And I think what's really exciting about TGI is that while there is a focus on health research, there's also an emphasis on active advocacy work and social entrepreneurship to drive real world change. And this photo on the slide is a picture of the Josola district, which is where the George Institute office is located in India. Next slide. So narrowing in, each of TGI's offices has their own research priority areas, and these are some of the research areas of TGI India. So focused on NCDs, mental health, strengthening primary healthcare systems and access, women's health, and evidence synthesis. But they do also have projects falling outside of these areas as well. On the next slide, are the three main projects and focus areas that I got to work on while I was at TGI. So my first area of research was around social participation for health, which I'll explain further in a moment. I got to work on a realist review focused on this topic and also contributed to a commentary published in the Lancet on social participation for health as well. Another project I worked on was an evaluation of non-communicable disease or NCD service delivery within primary healthcare settings in Southeast Asia. And finally, I was also able to contribute to research on building climate resilient and sustainable health systems with the Lancet Commission for Sustainability in Healthcare. Next slide. I'll give you a brief overview of each of these projects and what some of the specific tasks were that I worked on to give you a sense of the day-to-day at TGI. So starting with the first project, this was focused on social participation for health. If you're unfamiliar with the concept, social participation for health basically refers to engaging communities and the public when working on health policy or programs to ensure that they're people-centered. And when I joined TGI, I was interested in knowing what has been done to make these engagement processes more inclusive and what the outcomes of those efforts have been across the world. So I contributed to a realist review that they were working on to answer this question. I was able to contribute to finalizing the research protocol or plan for the realist review based on the research question. I also got to lead the development of the search strategy and actually drew on supports that we have here at McMaster Library to do that. We also decided to use a software called Covidence for this review. You might be familiar, Covidence is a platform that helps manage all the articles you find from a search for a review project and manages these articles while you screen them for inclusion or exclusion. But being a newer platform, not everyone on our team was familiar with Covidence. So I actually ran several training sessions in each phase of our review, getting our team familiar with the platform. And I also got to be innovative and come up with solutions to challenges that Covidence doesn't always address, like how to efficiently manage a multi-language review where each reviewer is familiar with only some of the languages that the articles are written in. So this led to honing in on my problem-solving skills as well to increase work efficiency. And then finally, I also supported article screening through the end of the summer. Next slide. A related piece of work that I got to contribute to, also around the topic of social participation for health, was a commentary published in the Lancet on the importance of social participation in advancing progress towards universal health care and coverage in various countries across the globe. And this commentary was really meant to equip policymakers and decision makers with tangible tips on how to build systems to engage with the public in an effective manner. So it was written in a concise way to allow the uptake of this knowledge by folks who are typically very busy. And it came out ahead of a United Nations high-level meeting on universal healthcare. And I think it's a great example of TGI's commitment to not just research, but also timely advocacy. And I'd encourage you to take a read if you're interested. Next slide. The next main research project that I worked on was an evaluation of NCD or non-communicable disease service delivery within primary healthcare settings in Southeast Asia. This project was actually commissioned by the World Health Organization Regional Office for Southeast Asia, also known as CIRO, which is heavily focused on NCD management and surveillance in this region. And so we got to work very closely with WHO colleagues on this. Our research question was what progress has been made in Southeast Asia in adopting and expanding access to people-centered NCD services in primary healthcare settings between 2014 and 2021. So it was a mixed methods research project drawing on data from policy documents, broader medical literature, key informants, as well as field data. Some of my responsibilities were reviewing policy documents from each of the 11 countries in Southeast Asia that we were studying to see any progression in commitments or strategies or approaches to NCD service delivery. I also got to lead a literature review to supplement our research with additional data from published medical literature on NCD outcomes in the region and how they've changed over the years. So this involved developing and running a search strategy, as well as coordinating a team of colleagues to screen for relevant articles and do data extraction and synthesis. I also contributed to developing interview guides for key informant interviews and developed presentations and a final report that will be presented to the WHO Southeast Asia office as well. Next slide. And then finally, I got to be involved in research focused on building climate resilient and sustainable health systems. My supervisor at TGI India, her name is Devaki Nambiar, is actually a member of the Lancet Commission for Sustainable Healthcare based at Yale University and the University of British Columbia, and invited me to be a part of this research at TGI. So I can't go into the specifics of the project work here as it hasn't been made public yet, but on a high level, this commission is focused on understanding how to mitigate ongoing impacts, environmental impacts of the health system, including transitioning to lower carbon health systems. It's also aiming to understand how we can adapt healthcare infrastructure and delivery systems to the increasing burden of climate-related illness that we're seeing. And also looking at how we can achieve these goals in both high-income and low-income settings. Next slide. In addition to all of these really wonderful and meaningful work opportunities I also got to do a lot of traveling and sightseeing both within and outside of New Delhi. I think this is an essential part of the QES experience to understand the context of the country that you're working in. And during the summer, I was able to visit a number of states and cities like Jaipur and Agra, as well as Gwalior and Jhansi, which are both beautiful cities with rich histories in the state of Uttar Pradesh. Importantly, I also got to visit the state of Punjab in northern India and my hometown. I have ancestral roots in Punjab and was actually born there, migrated when I was very young and hadn't been back for many, many years. So it was a really special experience to reconnect with my family back home and learn more about the community that I come from. And the picture in the bottom left is actually a picture of a sunset from my village. Next slide. So just wanted to touch briefly on what the outcomes of this experience have been for me overall. As I've mentioned, one big piece for me was getting to return to India. My family members and also learn more about where I come from. I think it really helped me build a stronger sense of self and identity that's really impactful on a personal level. Another huge outcome was getting to expand my personal and professional network. I was able to meet health systems researchers and practitioners in different parts of the world with different interests, and through them also discover more about my interests. And I also made really strong connections with other past and present QES scholars, and really expect those relationships and supports to last well into the future. In addition to that, through my QES internship, I actually got opportunities for further work. I was invited to join the Lancet Commission on Sustainable Healthcare after my internship as a commissioned scholar, and get to continue pursuing this key area of research. And this is something I wasn't anticipating, but I'm really grateful that QES led to this snowballing of opportunities that align with my interests. And finally, I also got to develop a range of personal and professional skills, which are explored further on the next slide. So going into the experience, I was really curious about what collaboration with global stakeholders on transnational projects look like. And I got to work with a range of such stakeholders like the WHO, other country partners of TGI, and experience what it's like balancing the various needs and priorities of different stakeholders in health systems strengthening work. Another key area was developing skills in critical reflexivity. So understanding the context of power and privilege that I'm coming from in relation to the work I'm doing and how that impacts my work. I think that this is a key area of reflection for many QES scholars as they engage in work that's rooted in communities they may not actually come from. I also got to lead various projects developing leadership skills, skills in critical thinking and problem solving. I would also say that some of the projects I worked on, such as the one with the WHO Southeast Asia office, were really fast-paced with deliverables and outputs expected each week. So it really gave me a chance to hone in on time management skills. I also learned about communication, how to frame research to make it accessible and likely to be uptaken by not just other researchers, but also the public and policymakers. And finally, I developed a strong sense of independence through this program. Living in a different country for an extended period of time, navigating a very different cultural environment, very different work landscape, is something that I'm confident now I can do moving forward. And on a personal level has also made me more open to the idea of travel and solo travel, whether for work or otherwise. Next slide. So all in all, this was a really impactful experience for me, and I'm so grateful to the Queen Elizabeth Scholars Foundation, the McMaster Health Forum, the George Institute, and especially my supervisor at TGI, Devaki Nambiar, for facilitating such a rich opportunity for me to develop as a young professional and also as an individual. I hope it was helpful to hear a bit about my experience, and happy to answer any questions when the time comes.